High blood pressure has earned its reputation as the silent killer for good reason. It creates no pain, shows no obvious symptoms, and for many seniors, it gradually intensifies over years until a devastating event like a stroke or heart attack finally brings it to light. What makes it particularly treacherous is how simple it is to overlook the daily habits contributing to it. Everyday choices, your food selections, physical activity levels, and stress management approaches influence your blood pressure more significantly than most realize. The reality is that many adults over 50 believe they're doing everything correctly. They take prescribed medications, attend regular checkups, and try to maintain active lifestyles. Yet, lurking within these routines are small, often invisible mistakes. Habits that appear harmless, but consistently drive blood pressure higher or reduce treatment effectiveness. Unless someone identifies these issues, they continue unchecked, silently straining your heart, brain, and entire circulatory system. That's precisely why this information matters. We're not here to overwhelm you with complex medical terminology or criticize you for making mistakes. Our goal is to provide clarity, to illuminate the most common blood pressure missteps seniors make, and offer straightforward, practical adjustments that can create meaningful improvements. Whether you've been managing hypertension for decades or have only recently started monitoring your numbers, this guide is designed to help you regain control of your health in an achievable, encouraging, and intelligent manner. Blood pressure management extends beyond numbers on a device. It's about maintaining activity, preserving mental clarity, sleeping soundly, and enjoying life with confidence. This journey begins by understanding what to avoid and what to implement instead. Let's explore the first blood pressure mistake and begin building a stronger, more stable foundation for your cardiovascular health, one smart habit at a time. Mistake number 1: skipping medications or taking them incorrectly. Blood pressure management typically begins with a prescription, and while medications represent one of our most effective tools for keeping those numbers under control, they only work when taken correctly and consistently. One of the most dangerous, and unfortunately common, mistakes seniors make is missing doses, taking pills at incorrect times, or discontinuing medication entirely without medical guidance. It's a behavior that may seem insignificant in the moment, but can lead to serious consequences over time. This happens for various reasons. Some people simply forget, others feel fine and assume the medicine is no longer necessary. Some worry about side effects, and many dislike the idea of depending on medications. Still, others cut pills in half or take them every other day to stretch prescriptions or reduce costs. While these decisions might seem reasonable, they can cause blood pressure fluctuations that strain the heart and elevate the risk of stroke, kidney damage, or heart failure. Blood pressure medication is precisely calibrated for your body's needs. It's not just about lowering a number, it's about protecting your entire cardiovascular system. When doses are missed or taken irregularly, blood pressure can spike unexpectedly. This elevation might not produce noticeable symptoms initially, but over time, it silently damages arteries and increases pressure on vital organs. Because symptoms are rare, many people remain unaware anything's wrong until a crisis occurs. What's particularly important to understand is that blood pressure medications often don't create a feeling of wellness, like other medications might. You don't necessarily feel better after taking them, which can make it easy to underestimate their importance. But behind the scenes, they perform essential work, easing pressure on your heart, improving circulation, and reducing your risk of life-altering complications. The good news is, this mistake is entirely preventable. The first step is making medication a routine rather than a question. Take it at the same time each day, using reminders like pill organizers, alarms, or daily checklists. If you miss a dose, don't double up without consulting your doctor. Call and ask for guidance. If you experience side effects, bring them up immediately. Often, alternative medications or adjusted dosages can help you feel better without compromising your cardiovascular health. Never stop taking your blood pressure medication simply because your readings appear normal. That's typically a sign the medication is working, not a reason to discontinue it. Always consult your physician before making any changes, no matter how minor. Even small adjustments in timing or dosage can impact the medication's effectiveness. It's also worth discussing affordability concerns with your healthcare provider. Many seniors try to stretch prescriptions due to cost constraints, but generics, discounts, or assistance programs are often available. Your health is worth having this conversation. Managing blood pressure is a long-term commitment, but one that provides greater energy, stability, and peace of mind. It begins with consistency. One pill, one day, one decision at a time. Your heart depends on you staying the course, and so does your future. Mistake number 2. Consuming hidden sodium. You might not reach for the salt shaker with every meal, but that doesn't mean you're avoiding sodium. In fact, most salt in a senior's diet doesn't come from what's sprinkled on top. It's hidden inside foods consumed daily. One of the most common and overlooked mistakes in blood pressure management is underestimating how much sodium is secretly entering your meals. High sodium intake directly correlates with elevated blood pressure. Salt causes the body to retain water, which increases blood volume in your vessels and places additional pressure on artery walls. Over time, this pressure taxes the heart and can lead to stroke, heart attack, kidney damage, or other serious health complications. But because the effects are silent, it's easy to dismiss them and even easier to forget where salt is hiding. Packaged foods, canned soups, sauces, frozen dinners, breads, deli meats, and even seemingly healthy options like low-fat salad dressings or whole grain crackers can all contain significant sodium. It's added not just for flavor, but for preservation. Many items labeled as light, diet, or heart healthy may still contain high sodium levels for shelf life and taste enhancement. When these foods become staples, because they're convenient, easy, or familiar tasting, sodium can accumulate rapidly. For seniors, this issue becomes even more critical. As we age, our kidneys become less efficient at filtering sodium, and our bodies become more sensitive to its effects. This means even moderate sodium intake can cause larger blood pressure increases than it might have decades earlier. It also worsens fluid retention, which can exacerbate conditions like leg swelling or congestive heart failure. The first step in correcting this mistake is awareness. Begin reading labels not just for calories or fat content, but for sodium. You'll be surprised where it's hiding. A single serving of canned soup can contain more than half your daily recommended sodium intake. Even a slice of bread or serving of cereal can contribute significant amounts if consumed regularly. Look for products labeled low sodium, less than 140 milligrams per serving, or no added salt whenever possible. Practical steps can make a substantial difference. Rinse canned beans and vegetables to remove excess sodium. Choose fresh or frozen foods without sauces. Cook more meals at home where you control the ingredients. Use herbs, spices, lemon, vinegar, garlic, or pepper to add flavor without salt. Over time, you'll discover these options not only protect your heart, but actually enhance your meals. Yes, retraining your taste buds requires time. If you've relied on salty foods for years, lower sodium options may initially seem bland. But your palate adjusts within weeks. You'll begin tasting the natural flavors of foods more clearly, and you might even find heavily salted foods become too intense or unpleasant. Reducing sodium doesn't mean sacrificing enjoyment. It means choosing a path that supports your health, protects your heart, and helps you live with greater clarity, energy, and stability. Every bite becomes a step toward balance, and every meal becomes an opportunity to nourish not just your hunger, but your overall well-being. Mistake number 3. Not monitoring blood pressure regularly. Blood pressure isn't something you can feel, at least not until it's dangerously high or causes a serious event. That's what makes it so deceptive. You could be going about your day feeling fine, even healthy, while your blood pressure silently rises. For seniors, one of the most common and risky mistakes is failing to check blood pressure regularly or relying solely on annual doctor visits to track it. Without consistent monitoring, small changes go unnoticed, and those small changes can lead to significant consequences. The reality is that blood pressure fluctuates constantly throughout the day based on everything from stress and sleep to what you've eaten and your activity level. A single reading at the doctor's office, even if perfect, doesn't tell the complete story. In many cases, those clinic readings may be falsely elevated due to anxiety or falsely low if you're having a particularly good day. That's why home monitoring is so powerful. It provides a more comprehensive picture of your blood pressure trends over time, and that insight could be life-saving. When you don't track your blood pressure, you miss valuable clues. Perhaps your medication isn't working as effectively anymore. Maybe a new dietary habit or stressor is beginning to take a toll. Perhaps a supplement you've added to your routine is interfering with your prescription. Without regular readings, you're left guessing. And when it comes to your heart, guessing isn't sufficient. Monitoring your blood pressure at home is one of the simplest yet most empowering habits you can develop. It allows you to identify patterns, catch spikes early, and provide your doctor with the data they need to make better decisions. It also helps you take ownership of your health. You're not just waiting for results. You're actively shaping them, one reading at a time. You don't need sophisticated equipment or medical training. Today's home monitors are affordable, user-friendly, and often feature large, readable displays with built-in memory. The key is consistency. Choose a specific time, such as early morning or evening, and measure at the same time daily. Sit quietly for 5 minutes beforehand, rest your arm on a table, keep both feet flat on the floor, and avoid talking during the reading. This daily practice builds a clear, honest picture of how your body is functioning. It's also important to maintain a log, whether on paper or using an app, and bring it to every doctor's appointment. This kind of record makes your visits significantly more productive, allowing your healthcare provider to identify changes, adjust medication if necessary, or detect warning signs early before they develop into serious problems. Some people avoid monitoring because they fear what they'll discover. They worry a high reading will create stress or anxiety. But the truth is that ignoring your blood pressure doesn't protect you. It simply gives potential problems more time to develop unchecked. Awareness is the first step toward improvement, and with blood pressure, early detection is crucial. Checking your blood pressure isn't just a task to complete. It's an ongoing dialogue with your body. And like any meaningful conversation, it works best when it occurs regularly, calmly, and attentively. Make it part of your daily rhythm, make it a habit, and most importantly, make it a priority, because your future depends on the choices you make today. Mistake number 4, letting stress go unmanaged. Stress isn't just something you feel, it's something your body carries. While we often associate high blood pressure with poor diet or insufficient exercise, one of the most underestimated contributors is chronic unrelieved stress. For seniors, allowing stress to remain unmanaged is a mistake that not only affects mood and sleep, but quietly and consistently elevates blood pressure day after day. Stress activates the body's fight or flight response, flooding your system with hormones like adrenaline and cortisol. These chemicals temporarily raise blood pressure by constricting blood vessels and increasing heart rate. A normal short-term reaction. But when stress becomes a daily occurrence instead of an occasional event, your body begins to remain in that heightened state. Your arteries stay constricted, your heart works harder, and over time, that persistent pressure creates damage that medication alone cannot always address. The challenging aspect is that stress often hides in plain sight. It doesn't always manifest as panic or outbursts. Sometimes it's subtle tension in the shoulders, tightness in the chest, restless sleep, or a quiet feeling of being overwhelmed. And because many seniors come from generations taught to push through or stay strong, it's easy to downplay these feelings or ignore them completely. But ignoring stress doesn't make it disappear. It just gives it more time to settle into your system, draining your energy, shortening your patience, and quietly spiking your blood pressure. The good news is that managing stress doesn't require dramatic changes or expensive therapies. It begins with small, intentional actions that calm the nervous system and restore balance. Deep breathing, for example, slows heart rate and relaxes blood vessels. Gentle movement like walking, yoga, or stretching releases tension and stimulates mood-enhancing endorphins. Quiet time in nature, listening to music, or practicing gratitude through journaling or prayer can also reset the stress response. Even conversing with a friend or simply expressing your emotions can lighten the mental burden. The key is building a habit of daily stress management. Not just reacting when things become difficult, but creating routines that give your mind and body space to decompress. Think of it like dental hygiene. It's not just for when problems arise, it's for preventing issues from developing in the first place. If you've been living with unmanaged stress for years, be gentle with yourself. This isn't about assigning blame. It's about recognizing where change is possible and taking one small step at a time. You don't need to resolve everything overnight, but when you begin making space for calm, for reflection, for self-care, your body responds, not just in your mind, but in your blood pressure, sleep quality, digestion, and overall sense of peace. Stress may be invisible, but its effects are very real, and the power to manage it always remains within reach. One breath, one walk, one moment of stillness at a time. Mistake number 5. Ignoring physical inactivity. When it comes to managing high blood pressure, what you don't do can be just as significant as what you do. One of the most overlooked yet most impactful mistakes seniors make is ignoring physical inactivity. In other words, sitting too much, moving too little, and assuming that rest is always the best approach. While rest has its place, lack of movement can gradually, silently increase blood pressure and force the heart to work harder than necessary. Physical activity helps regulate blood pressure by strengthening the heart. A stronger heart pumps more blood with less effort, which reduces the force on your arteries and helps maintain your numbers within a healthy range. Exercise also improves circulation, reduces inflammation, supports weight management, and lowers stress. All key factors in cardiovascular health. But when movement disappears from daily life, the body begins losing efficiency. Muscles weaken, circulation slows, and pressure within blood vessels starts to rise. For many seniors, the challenge isn't motivation, but uncertainty. Concerns about joint pain, fatigue, or fall risks can make exercise seem intimidating. However, physical activity doesn't need to be strenuous to be beneficial. Even light movement performed consistently can deliver real results. A daily walk around the neighborhood, morning stretching, or gentle chair exercises while watching television can all help get the heart pumping and blood flowing. In fact, one of the most powerful changes you can make is simply sitting less. If you typically watch TV or read for extended periods, try standing every 30 to 60 minutes. March in place briefly, walk to the kitchen, do a few shoulder rolls or toe taps. These short movement bursts throughout the day help interrupt long sitting periods, which can otherwise stiffen arteries and raise blood pressure over time. What matters most is consistency. Moving your body regularly signals to your heart, blood vessels, and brain that you remain engaged with life, still active, still strong. And over time, that message becomes reality. It's also important to discover forms of movement you enjoy. That might be dancing, gardening, water aerobics, or a simple stretching routine in morning sunlight. When exercise feels pleasurable rather than punishing, you're more likely to continue, and the more it becomes habitual, the more your body thrives. If you're uncertain where to begin, consult your doctor or a physical therapist. They can help identify safe, appropriate movement options based on your current health and mobility. Remember, this isn't about becoming an athlete. It's about maintaining independence, preserving balance, and giving your heart the support it needs to serve you for years to come. Ignoring inactivity might seem harmless, but over time, it places unnecessary strain on your heart and blood vessels. Movement is medicine, and every step you take is a step toward lower blood pressure and a stronger, more confident you. Mistake number 6. Overusing caffeine or alcohol. A morning coffee, an evening glass of wine. These small pleasures are part of daily life for many, and in moderation, they can be exactly that, pleasurable. But for seniors managing high blood pressure, overusing caffeine or alcohol is a mistake that often escapes notice. These substances don't appear dangerous in the moment, but they can quietly elevate blood pressure, interfere with medications, and create more health challenges than they resolve. Let's begin with caffeine. Found in coffee, tea, soft drinks, energy drinks, and even chocolate. Caffeine is a stimulant. It narrows blood vessels and increases heart rate, both of which can temporarily raise blood pressure. For some individuals, this effect is minor or brief, but for others, especially those already dealing with hypertension or heightened sensitivity to stimulants, even a small amount of caffeine can push blood pressure into concerning territory. What's challenging is that the effect varies significantly between individuals. Some seniors can enjoy daily coffee without issue, while others may experience spikes lasting hours, sometimes without even realizing it. The key is awareness. If you consume caffeine regularly, it's worth noting how your body responds. Consider checking your blood pressure before and after your morning brew or afternoon soda. If you notice a pattern of elevated readings or symptoms like headaches, restlessness, or a racing heart, it might be time to reduce intake or switch to decaffeinated options. You don't need to abandon favorite rituals entirely. Just make thoughtful adjustments that support cardiovascular health. Alcohol presents a different challenge. In small amounts, it may seem to promote relaxation, lowering your guard after a long day. But in larger or more frequent doses, alcohol raises blood pressure and can significantly interfere with hypertension medication effectiveness. It also contributes to dehydration, poor sleep, weight gain, and increased emotional stress, all negatively affecting blood pressure. For seniors whose bodies process alcohol more slowly, these effects can be amplified and persist longer than expected. Consuming more than one alcoholic beverage daily can begin shifting the balance from occasional enjoyment to chronic risk. And combining alcohol with blood pressure medications can produce various side effects, including dizziness, confusion, and liver strain. These risks increase further when other medications are involved, which is often the case for older adults managing multiple conditions. The good news is that moderation, even small reductions, can make noticeable differences. Cutting back on caffeine or alcohol can lead to lower blood pressure readings, improved sleep, more stable energy levels, and enhanced focus. In some cases, reducing these substances can also decrease the need for additional medications. Giving up coffee or wine doesn't mean sacrificing comfort. Numerous enjoyable, heart-healthy alternatives exist. Try herbal teas like chamomile, mint, or rooibos. Sip warm lemon water, or create your own flavored sparkling water with fresh fruit and herbs. These simple substitutions can provide the same sense of ritual and relaxation without unwanted side effects. Ultimately, it's not about restriction, but intention. Understanding how caffeine and alcohol affect your body empowers you to make better choices. Choices supporting not just your blood pressure, but your overall health and quality of life. Your heart doesn't demand perfection. It asks for care, and each step toward balance is a step toward a stronger, steadier you. Mistake number 7, not communicating with healthcare providers. When it comes to managing high blood pressure, having the right support system is just as essential as taking the right medication or consuming the right foods. At the center of that support system is your healthcare provider. Yet, one of the most common and avoidable mistakes seniors make is failing to keep communication channels open with their doctor or care team. Whether it's missing appointments, withholding symptom information, or assuming things are good enough, inadequate dialogue can lead to missed opportunities and overlooked warning signs. It's easy to fall into a pattern of simply renewing prescriptions and attending annual checkups. But blood pressure isn't a set it and forget it condition. It fluctuates with changes in stress, activity level, sleep, diet, other medications, and even seasons. If your doctor isn't fully informed about how you're feeling or what's occurring day to day, they're working with an incomplete picture, making it harder to identify problems early or fine-tune your treatment. Many seniors hesitate to speak up out of fear of seeming difficult, being judged, or bothering their doctor. But no concern is too minor if it relates to your health. Whether you're experiencing unusual dizziness, a side effect you've been trying to ignore, a new supplement you've started, or a recent routine change. All this information helps your provider keep your care plan safe and effective. Medication side effects, in particular, are among the most underreported issues. Some people simply stop taking their pills because they dislike how they feel, but never mention it to their doctor. This can lead to uncontrolled blood pressure or, worse, serious complications. A brief conversation could result in an adjusted dosage, a different medication, or lifestyle modifications that make a tremendous difference. Home blood pressure readings should also be part of your communication. Bring your log to appointments or share it through a patient portal if available. Seeing the trend, not just a single reading, allows your provider to understand what's working and what isn't. If readings are inconsistent, they can help determine why. Even mental and emotional health matters in this conversation. Stress, loneliness, depression, and anxiety can all contribute to rising blood pressure. And your provider may be able to refer you to counseling, support groups, or community programs that can help. If visiting the clinic is challenging due to mobility issues, distance, or transportation concerns, ask about telehealth options. Many practices now offer virtual appointments that make staying connected easier without leaving home. Effective communication doesn't require lengthy discussions, just honest ones. Your doctor is your partner in health, not a judge. The more they know, the better they can guide you. And you needn't wait until your next appointment if something feels wrong or if you're uncertain about a reading, side effect, or lifestyle change. Reach out. Your health isn't a solo project, it's a collaboration. And maintaining open communication is one of the smartest, simplest actions you can take to protect your blood pressure and your future. Managing high blood pressure needn't be overwhelming. It doesn't require a perfect lifestyle, an endless list of restrictions, or constant worry. What it truly requires is awareness of the daily habits that matter, the signals your body sends, and the power you possess to shape your health one decision at a time. The truth is that blood pressure isn't just a number. It's a reflection of how your body is living, breathing, resting, moving, and responding to the world around you. Now you've seen the 7 most common mistakes that often go unnoticed. And more importantly, you've learned how to avoid them. From understanding your medications to monitoring sodium intake, staying active, managing stress, communicating with your healthcare provider, and making mindful choices about caffeine and alcohol, these are all manageable, realistic changes that don't require completely overhauling your life. They simply ask you to care for yourself with greater consistency and intention. At Health Wisdom, we believe good health is built one habit at a time. You don't need to implement everything at once. Just select one area to begin. Perhaps it's checking your blood pressure regularly or replacing a salty snack with a fresh alternative. Maybe it's setting medication reminders or calling your doctor about something that's been concerning you. Whatever it is, know that every small step represents progress toward a healthier heart, a steadier life, and a stronger you. If you found this information helpful, please like this video, subscribe to Health Wisdom, and share it with someone who might benefit from clarity and encouragement. Because when we support each other, we all grow stronger, steadier, and better equipped to thrive, one heartbeat at a time.